Well, the thank you is more like, thank you for noticing. Thank you for finally asking that question instead of just chalking it up to my quote unquote old age, right? Because I do have to say the majority of people that I'm de-prescribing these medications in are people who would be primarily preventing, right? And who are over 55, probably over 65, right? So they're going to notice the most because they would have been told, you're just getting old. You're 63, and your muscles are going to hurt because you're old, and so they're going to chalk it up to that. But the moment you start saying, wait a minute, when did this start? Does it correlate at all with when you started that medication? And as a reminder, it may be the first time you people hear it, but I doubt it. Cholesterol is part of all of our cellular membranes.
Yep.
If our cells have to regenerate, if you tear a muscle, you have to produce muscle cells to replenish that, to repair it. If you don't have cholesterol, if you don't have a fair amount of cholesterol in your system, where are you going to get the building blocks to do that? Okay. So if you make your healing suboptimal by taking a medicine that does alter the cholesterol metabolism, it appears to me, based on side effect profile, that it really messes it up. So the moment you start asking the patient, are you having a hard time with that? Does that make you sore? Do your nerves seem to be, getting some numbness? They're not working very well. Is your memory going? That sort of thing. They'll be like, actually, yeah. And it does correlate with right when I started that medicine. And so then you de-prescribe it, and they usually experience a significant difference within that first month. And they'll come thank you for paying attention, not necessarily directly, okay, I'm thanking you for stopping my statin. They'll say that, but it's more like, thanks for listening and figuring out that it was the statin causing that.